So I've been sitting on this subject that I've been bringing up with the majority of my friends and, professionals that I'm working with, trying to figure things out. Because my experience as a caregiver taught me a lot about neurological disorders and emotional well being, and how some emotional outbursts have absolutely nothing to do with the person's emotional state or their ability to emotionally regulate. And so I was going down the list that my therapist gave me, and it's like, dude, but I'm already incorporating all of this into my daily routine. That can't, like, if that's all we can fucking do, like, there's no way to control what it is that you're asking me to do without actually suppressing my body's natural processing. And this has been a thing since I was a child, and it's not because of my inability to emotionally regulate. Oftentimes when I'm left to cry it out, that crying comes and goes within minutes, if it's not connected to a triggered migraine or something else. And when I was a caregiver, I remember that we had a lot, and this happens a lot in the memory care facilities, where you'll have a client that is struggling that day with just tearing up. And it's not necessarily the tearing up that freaks them out, it's not knowing why they're tearing up. And so, in that particular setting, the best thing you can do is continue with whatever activity that you're doing. If you're getting dressed, continuing with getting dressed, even though you're tearing up. And just because when that happens to me, and I'll explain afterward, but yeah, just continuing with whatever it is that you're doing. I remember one client in particular, and it was the first time I had experienced this, and I had read about it because when I became a caregiver and I made some mistakes because I didn't know even telling a person with memory care problems a story could lead to them actually thinking that the story was true. And you have to be very careful because they have a literal form of thinking the way neurodivergents do. But we, as neurodivergent people who are still somewhat in our right mind, we oftentimes can decipher that because we've been through therapy since we were kids. So we learned to try to not take people's shit seriously. But when I'm having a migraine, it's easy to confuse me. It is so easy to confuse me. Even the text that I was writing back and forth to one of my advocates the other day, I was completely confused. Like, it took her explaining, like, if you, like, this is what will happen. And it's like, shit, I thought this is how it was. Like, it just, and so I'm learning not to answer phone calls or text messages during that state of mind. But the thing is, you also have that muscle memory and that reflex to do it. So when you're in autopilot during even vestibular and hemiplegic migraines, I've noticed both of those are very likely to confuse me. So when I experienced this as a caregiver, I remember the nurse telling me, don't stop asking her why you're crying. Because that was my first instinct. Like, well, what happened? Did you hurt yourself? And she's like, I don't know. And that's when the nurse walked in and she explained to me, like, she took me into the other room. She's like, this is this. And I was like, oh, I've heard of that. And then she explained, they're not necessarily emotional flashbacks. A lot of us are calling some of these things emotional flashbacks because some of them are. If you suffer from CPTSD, some of them are. However, when your brain is having these fluctuations, if you are having a migraine, in her particular case, apparently she might have been having a seizure. So she was given her medication, and she would go in and out of these bouts of just crying randomly. But we kept writing cards, because she kept bringing out the birthday cards that family members had sent her. So she was stuck in that. So what we kept doing is just writing the thank yous, and it kept her in that moment. So she no longer thought about the crying. Her body kept tearing up for no reason, the way this eye does a lot when I'm having a migraine or a cluster headache. However, for her in particular, it was just both eyes, just tearing up. And so when we go about life, we make people uncomfortable. I make people uncomfortable. A lot of my friends groups, I make them uncomfortable. And oftentimes I get to the point where I get so frustrated at the misunderstanding because they only see it from one side or one perspective, which is great. I can see it from your side, but you want me to accept it from your side when my experience is different. And then when I do it, it's trauma dumping. And it's like, okay, cool. We can call it whatever you want. I have trauma dumped on you so that you can see how your behavior affects other people. And until you have experienced how it has affected you, you don't understand the concepts that I'm talking about, because I tear up and people always want to stop the conversation. Hey, do you want to take a minute? It's not always because of stress. When it happens because of stress, yes, I take that minute. But when it's because of migraines, there's no point in us taking that minute, because taking that minute might mean we need to take 24, 48, 72 hours before we can finish this conversation. And oftentimes, because migraine patients are not taken seriously, friend groups don't take that into consideration. So I can consider you, your life, your experiences, and make sure that I learn to move around in a way where I'm not constantly triggering you for no unnecessary reason. But others will see you tearing up or talking about your experiences or how they affected you as trauma dumping when it makes them uncomfortable. Tearing up doesn't necessarily mean the person is emotional. Oftentimes when I am tearing up, I'm not emotional at all. Especially during migraine days, especially during vertigo days. I will start tearing up just because I'm so dizzy that I get scared. It's terrifying sometimes. It's not necessarily an emotional reaction. We move through this world trying to avoid discomfort altogether. And we don't realize in that avoidance of that discomfort, we make the people that we want to come out into the world. Like, I'm always being encouraged by my support groups and by all of these mental health advocates to go to these day programs and shit like that. One, they keep placing me with people who have extreme issues with self-care, and I get that. I do too, because I don't have access to a bathroom where I'm not throwing up because of the perfumes all the time. So I'm having to go to a place where I'm being exposed to smells and individuals who are triggering my migraines during the day when I should be sleeping because of my light sensitivity. Those are the options we are given for socialization. We're already having trouble socializing because even going to the grocery store can trigger a migraine, but you're somehow placing us in the same category with every other mental health disorder, as if disability depression was the same, or chronic illness depression was the same as a normal major depressive disorder. Yes, that's also a chronic illness, but it's caused by different things, and our adaptation is different. Oftentimes, I was told that it was because I just wanted to be a night person who just wanted to be partying and blah, blah, blah. No, that's the hours that it was best for me to be awake for my eyesight. And on top of it, when I could still drive at night, it was perfect. I'd get extra jobs at night and I'd be more effective during the night shift. I was great at working the night shifts. I was really good at it. Why? Because I could keep myself busy during the night shift on the clients, on myself, until I started getting sick because of it. Because at home, people were waking me up instead of respecting the hours that I needed to sleep. And that's always going to be the case if you live in a household where consideration is expected from you, but it's not given to you to accommodate your conditions. A lot of these independent living households are doing the same thing. They're doing the same thing and often making it very hard for us to accept some of these living arrangements because they're making us sick. The sleep deprivation, the noise pollution, the inability to even have a fan on because other members of the household have too many things connected. So now your room is the only room where you can't turn shit on. And also you don't have access to a window. Yes, we accept these situations because we're desperate and living in our car is just as bad. But I realized that accepting it was just as dangerous as living in my car. So living in my car is what I accepted, even though because of it, I don't have access to IHSS the way I would so that someone can be driving me around. I don't have access to proper medical care because my shit is always being delayed and denied unless I pay out of pocket because my workers aren't on top of it. And then I'm being seen as the person who is uncooperative because in the time of the day when they need to be making these phone calls, I'm sleeping. Or when I tell them you need to call me before a certain time because I get confused. A lot of these workers chose to call me after those times and did confuse me. I even placed complaints when I was still with Kaiser because of it. You are taking advantage. I am literally telling you my triggers and telling you where I'm struggling and where I need help, and you're deciding to make decisions for me at that time by calling and getting confirmations during the times of day when I asked you not to do that. My new advocate, fuck, dude, she really surprised me with what she did. Like, it relieves me to know that somebody is actually trying to protect me from making improper choices or decisions during a time when my brain is not functioning well. Because that's how we lose our independence. That's how we lose our resources. That's how a lot of people get scammed out of properties, their homes. And they do it deliberately. They do it deliberately to be able to control how disabled people live, because essentially it is expensive to keep them alive, and housing independently is not that easy to do. But also coming up with independent living household situations where you're not causing more harm, that's also difficult to do. It's very difficult to do when you have entitled people living in the household that believe that just because they pay a little bit of rent, they're entitled to harming others in the household by sleep depriving them, harassing them, going through their trash, exposing them to toxic shit because of plumbing and electrical problems. Just because we're broke doesn't mean that we need to be living in worse conditions than we did on the street. But that's what we're offered. And if you join those programs, then you lose your access to the homeless programs, which is what happened to me last year. And then I had to start all over. And they still give you misinformation, limited information. And even if you're doing everything that they're asking you to do, they still find ways to make it about you not doing what they're asking you to do, or even being hostile. I've been called hostile. I've been called uncooperative, argumentative when I'm looking for clarity. I don't want to keep fighting with you. You should have been protecting me the same way my new advocate was protecting me. Because I told you guys over 2 years ago that I was struggling with this shit. And it was just another reason to be abused, not only by my family, but by the system itself. Me getting emotional and you not being able to hear my words when I start crying is not me having a miscommunication problem. It's you having a listening problem. Because the moment you believe I'm emotional, you no longer hear the words that are coming out of my mouth. Belle. You only sense the emotion and you want to shut down the conversation, even if I'm communicating clear. And it really sucks that in order to be listened to at doctor's appointments, I have to take people to my doctor's appointments. That's not okay. Because I've been communicating clearly for years and ignored. And that's not okay. Because that led to my family believing that I was not seeking care when I was, not doing my care when I was. and so on and so forth. We can spend all the time we want explaining our conditions to the people around us, whether that's friends, social workers, nurses, doctors, or our own family. If they don't want to actually consider you, they're not going to pick up on anything that you're saying. The disabled and chronically ill need consistency. If you do not provide consistency, we will start to move away from you because we can't provide consistency either. And as much as we want to, we see how us being a bad friend is also affecting your ability to be a good friend to us. And as much as we want to pretend like that relationship can continue, we can't, because we don't have the energy for socialization. If you have us in survival without proper health care, without proper food, and without proper housing, at what time do you want us to have the social battery not to be going off on each other? Oh, but this is when you should be practicing your tools. No amount of mental health tools are going to save you from a severe migraine making you look like a crazy person when you go off on somebody. No amount of mental health tools can prepare you for the fear that comes with an extreme bout of vertigo from a vestibular migraine. No amount of psychological tools are going to prepare you for the blindness that comes with some migraines. And no amount of mental health tools are going to prepare you for when you're experiencing symptoms of a stroke because of migraine. And going to the ER and having people pinching your leg. Oh, are you sure you don't feel it? Because you're smiling during the entire process. Because for me, when I'm nervous, I smile. And I'm not taken seriously. When I'm in pain, I giggle. I know it's not normal, but that's my pain response from being ignored my entire life. The body has to find a way to release the pain that you're in. That's how bad sensory processing disorders get when they're being ignored, because you're interpreting a smile as the person not being in pain. You're interpreting tears as a person not being grounded in the conversation. But the interpretation and the perception of that interpretation is incorrect, because those are actual symptoms that are literally telling you what are happening with that chronically ill person. I was accused a lot of times of med seeking because I'd use the phone to distract myself after being in the ER for over 8 hours, sometimes 12, sometimes more. Nurses and doctors in the ER are some of the worst, most biased, dehumanizing people I have ever experienced in my life. To ask a chronically ill person experience symptoms of aphasia or even stroke after they've had that experience, to ask them to go into the ER on their own without any advocacy, because yes, you can ask for an advocate, but then you're going to have to ask for it every fucking time, because you're going to get different treatment when you ask for an advocate versus when you do not ask for an advocate, especially if you're experiencing the inability to communicate your needs because of the aphasia and other things that come with migraine. It's not just scary, it's potentially dangerous. When I split my head open, they sent me home in an Uber and I had lost consciousness. I gave the reception one story, and the reception did not give the paramedics the story I gave the reception. So when the paramedics asked me and I was already suffering memory loss, I gave them a different story. So then there was contradicting shit. So they let a person who lost consciousness, got 12 staples on their head, less than 8 hours or 12 hours from being in the emergency room, sent home to a hotel in an Uber, unable to clearly think for themselves, just because they did a test to make sure that I could walk to the bathroom. That obviously guaranteed that I was making clear choices. And it was my fear that made me want to get out of that. But that's a muscle memory. I've done that after surgery. Would you send a patient after anesthesia? If they pulled their IV out, would you send them home? Would you allow them to go home? No. You'd be legally required to keep them there until the anesthesia wore off, to make sure they were safe enough to go home if they were there by themselves. Y'all put us in danger and then expect us to go back to the doctor willy-nilly to be harmed again. The system does the same thing. Social workers do the same thing. A lot of these homeless programs do the same thing. If you cannot advocate or defend yourself, they don't give you the necessary information for you to move forward. They'll keep you in the hole as long as possible until you fall into either a psychiatric program or a drug program, because that's what they push the most. Psychiatric programs and drug programs. Because the chronically ill must be mentally ill as well, even though the mental illnesses are being caused by the medical system and the social working system and the ECM program that's supposed to be an advocacy program, which don't even get me started on that. The housing navigation programs that are a complete joke, especially for a chronically ill person experiencing as much memory issues that come with what I'm experiencing. So you can either give your independence away to a system that will continue to harm you with delays in your care that are causing the memory problems so that you can't defend yourself. But that's not seen as malpractice. Make that make sense. It doesn't make sense to me. And that goes for families. I think every single family not wanting, if the patient or client does want to be in day programs and they're not wanting to allow their family to be in day programs, I think someone should question that, because yes, that could be because of health problems, but that could also be because of the controlling type of family situation that they're in, the way I was. Keep that in mind. Families will ruin reputations, and if you didn't defend yourself early on, oftentimes whatever is said about you, that is what is the permanent truth that you have to live with. And you have to get to a point where you are either going to focus on recovery or focus on clearing your name. Honestly, I don't think clearing the name is even worth it. I'd rather think people think I'm shit, because at least that tells me who they think I am. And they don't deserve to get to know me. Because if you believe that that's my presence, then that's what you believe. I'm not going to try to change people's mind anymore. However, I'm not going to pretend that the system hasn't given me this experience solely on the fact that you don't seem to understand that emotional outbursts or seemingly emotional outbursts are not always actual emotional outbursts. This is the same reason why couples have problems, because when they're trying to have conversations and someone has that kind of issue, that's why I don't get along with my friends for very long, because I've had these issues since I was little. Sensory emotional outbursts and meltdowns and shutdown are nothing to do with emotions half of the time. And the moment that you keep putting it on that instead of trying to direct the problem, I'd end up having a fever before I got the medication I needed for the migraine. And that was since childhood. They'd wait till I had the fever. By the time I had the fever, the migraine was full on and I was already vomiting. The emotional outburst was the indication that pain was coming on. I just didn't know how to communicate it. That happens to people with memory care problems all the time, and migraine sufferers are some of the most misjudged people. So are autistic children and ADHDers, and it's very, very frustrating. You know, I haven't had a lot of friends in recent years with other neurological conditions or cognitive conditions, but those are the ones I have the most experience with. And I gotta say that until we stop judging a person's emotions as their emotional state, we're going to miss a lot of good conversations, and we're also going to let a lot of people fall through the gaps of care because of the fact that our own doctors don't know how to handle anything that seems out of control. And if that's the case, you shouldn't be a doctor. Or you should be the one who walks around the hospital with an advocate to explain to you why a person in chronic pain might be crying when you walk into the room, or a person with medical trauma might be shivering the moment you walk into the room. I flinch up and I mask. So I internalize that shit, which makes my symptoms worse when they're out of the room. Sometimes it even makes my nausea worse once they're out of the room, because my entire body tenses up and I internalize my emotions. Some people outwardly express those emotions in the ER, and some doctors can be total dicks about that. Those are the people who need the advocate, not the patient. But forcing the patient to have an advocate because those doctors haven't done the work themselves but are claiming that we need the psychiatric help are the ones that need to go to psychiatric care. And we need to start taking that seriously. You need to start making doctors and nurses go to psychiatric care when they exhibit these kinds of behaviors, so that they learn. If they can't learn bedside manners, so that they can at least learn to connect to their own emotions, so that they don't misjudge symptoms. Because even people get missed with seizures for having giggling problems like mine. So really, really, really look into these doctors. And let's bridge that gap between patient advocacy and patients being allowed to advocate for themselves and being taken seriously. I love you and have a great day.